Hello, everyone. Welcome to tonight's webinar. My name is Brittany Garcia. I am the program coordinator for the TSU Baylor College of Medicine P20 Cure program. And so for tonight's webinar topic, it will be over obesity, nutrition, and cancer, what the community needs to know. So, as always, thank you again for coming tonight. There will be a question and answer session at the end of the speaker presentation. So please post your questions in the Q&A box. And so for tonight, our moderator will be Dr. Nkechi Ogbo. She is TSU's Health Equity and Community Engagement Pharmacist. Thank you again, Dr. Ogbo, for being tonight's moderator.
Thank you so much, Brittany, for the hard work you keep doing for us at P20 Cured. Want to appreciate you. Please, next slide. My name again is Nkechi Ogbo, and I have the pleasure of serving as the moderator for today's event. Just a brief overview. This is grant funded, and it was the only the P20 Cured was the only one funded in the 2023 to 2027 cycle, and it's a $2.4 million grant from NIH and NCI. And it's the full title of it is P20 Partnership Collaborative Union for Cancer Research, Education, and Disparities. And pretty much with this, it's a combination, it's a combo between Baylor College of Medicine and Texas Southern University, and just to do everything about cancer research, education, community outreach, and training the next generation to be able to also be passionate about this and help move the needle forward in the area of cancer research and innovation. Next slide. And these are all the wonderful people that keep the wheel spinning at the TSU and Baylor College of Medicine P20 Cured program. The multiple PIs are Dr. Veronica Ajewole from the TSU side. She's also the director, and then Dr. Rouse is the director and Baylor College of Medicine PI for this grant. Next slide. Again, welcome to this evening's webinar. Please feel free to scan the QR code in the link here if you are a member of the CHW workforce and want to earn some credit from this. We will definitely send out your certificate once all the your information is put in here within the next week or two. And also feel free to also fill out our post survey, because we want to hear what you think, what we are doing okay, what we need to improve on, and because we do value your feedback. Thank you. Without further ado, we have Dr. Betsy Escobar, who is not the moderator, but she's actually the speaker for today's event. Dr. Betsy Escobar is a bilingual physician and public health advocate committed to empowering individuals to take charge of their cancer risk. She is so passionate about bridging clinical expertise and community engagement and addressing cancer health disparities, increasing minority representation in clinical trials, and ensuring equitable healthcare access. Dr. Escobar's mission is to transform cancer prevention by building strong community partnerships and also delivering clear, impactful education that empowers people to make informed healthcare decisions for themselves and their families. Without much further ado, thank you so much, Dr. Escobar, for giving us 1 hour out of your precious evening to discuss this important topic with us. Thank you. And feel free to share your screen, Dr. Escobar.
Thank you so much. Yes. Good evening, everyone. I am Dr. Betsy Escobar, and I am very happy to be here today to talk to you about something incredibly important: taking control of your personal cancer risk. We all know somebody that has cancer, but the good news is that we can do things to lower our chances of developing cancer. And today we will discuss how our family history, lifestyle choices, and environmental factors all play a role in cancer risk and what we can do to take charge of our health. So let's start with the basics. What is cancer? So this figure shows you the evolution from normal to cancer and how cancer develops. Cancer happens when our cells in our body start growing out of control, normally the cells grow, divide, and die in a controlled way. But when something goes wrong, these cells don't stop growing and they start forming tumors that can spread to all of our body. And this other figure shows our lifetime risk of developing cancer. About 40 out of 100 people will develop cancer, but there are many types of cancer. And while some risk factors are out of our control, many risk factors can be reduced through lifestyle choices. So the big question is, how can we lower our cancer risk? And there are three key areas that we're going to focus on today. The first one is our genetics. Our family history can give us clues about how our risk for certain cancers. The second thing is our lifestyle, what we eat, how active we are, and habits like smoking and drinking can impact our risk. And the third thing is our environment. Exposure to things like pollution, chemicals, and even too much sun can increase our risk. And understanding these three key factors can empower us to make healthier choices. Did you know that some cancers run in families? If a close relative, like a parent or a sibling or a grandparent, has had cancer, your risk may be higher. But don't worry, because this doesn't mean that you'll definitely get cancer. It just means that you should be aware and take preventative steps. So, gatherings with your family, like family reunions, and gathering family health information is an essential step in understanding your cancer risk. So, if you go to a Thanksgiving dinner or a family reunion, you can respectfully ask your family members that you're trying to try to be on top of your health and would like to know more about the illnesses that run in your family, like cancer. And in the families, there's always somebody that is kind of the historian or the go-to person that knows everything about everyone in the family. And that person can really be helpful to try to understand our cancer risk. And if your family is not helpful in gathering this information, there are other means to get the information, like death certificates to gather the information. I wanted to show you here that there are some great tools like My Family Health Portrait, that this is a free app that you can download from Google Play or the Apple Store. And if you scan the QR code, and this free app can help you gather your medical and family history to kind of assess your cancer risk and give you a family tree that you can take to your doctor and then talk more about your risk and some of the steps that you can take to lower your risk, like early screening options or even talking to a genetic counselor for genetic testing. So this is a very helpful app that it's completely free and you can download by scanning this QR code. Now let's talk about the social determinants of health, because understanding them is very important when we talk about lifestyle and environmental factors associated with cancer risk. So, factors like income, education, access to healthy food options, healthcare, and the physical environment, and even our zip codes of where we live can all affect our cancer risk. And it's very important to advocate for policies that make healthcare and prevention more accessible for everyone. So, lifestyle choices are one of the biggest ways that we can lower our cancer risk. And this graph shows you the percentage of cancer cases that are attributable to selected lifestyle factors that can increase your cancer risk. So, for example, smoking is linked to many types of cancer, and it can dramatically increase our cancer risk up to 20%, which is a lot. There are other factors like excess body weight, physical inactivity, poor diet, and alcohol consumption that can also increase our risk. Being exposed to a lot of sun or UV light radiation, if we use any tanning beds, can also increase our cancer risk for skin cancer. And there's also certain infections like HIV, hepatitis B, hepatitis C, H. pylori, and the human papillomavirus, HPV, that can also increase our risk for cancer. Luckily, we can change our lifestyle to decrease this risk. For example, we can quit smoking. Uh, Quitting can make a huge difference. It is very hard to do it, but it's still doable. And there are a lot of resources like quit lines that can make it easier to quit. Eating healthier, like choosing to eat more fruits and vegetables and whole grains to protect our cells. Staying active for at least 150 minutes a week or 30 minutes for 5 days out of the week can be very helpful. And also limiting our alcohol consumption can make a great difference. Also, protecting our skin by wearing sunscreen and hats, using SPF of greater than 30, and also avoiding using tanning beds can really help. And there are also two vaccines that can prevent cancer by protecting us against viruses like HPV and hepatitis B. And you can talk to your pharmacist or your doctor to get vaccinated against these viruses. There are also environmental factors like the air, the water, food, soil, and products we use that can increase our environmental toxic chemical exposure. But there are some things we can do to protect us. For example, reducing our exposure to harmful chemicals by using there are cleaning products that have a lot of chemicals, and perfumes like air fresheners and deodorizers have a lot of harmful chemicals as well. We can try to use more natural and less expensive cleaning products like baking soda and vinegar to clean our home. And we can stop buying deodorizers like the air fresheners and candles. And you can also buy organic veggies and fruits if your budget allows to decrease your exposure to pesticides. Also, like filtering your water, there are some water sources that have contaminants linked to cancer, like arsenic, chromium 6, and pesticides. And you can buy like a Brita water filter, and that could help remove some of the contaminants in the water that can decrease our cancer risk. Another thing to be mindful about is our indoor air quality. So, according to the Environmental Protection Agency, the air inside our homes is 2 to 5 times more polluted than the air outside our homes. And this is due to lack of ventilation, radon gas, using cleaning products, air fresheners, paint, personal care items like hairspray, also cooking using gas stoves, burning candles and fireplaces can produce carbon monoxide, benzene, and formaldehyde, which can cause cancer. So, to deal with this problem and reduce your risk, you can air out your house for 5 to 10 minutes a day, creating a strong cross breeze by opening all the windows and doors, and that can quickly replace the stale indoor air and with fresh outdoor air, and that can help remove some of the pollutants. There are many resources available to help you on your cancer prevention journey, and the National Cancer Institute helpline is a great place to start. You can scan this QR code or you can call on live chat Monday through Friday from 9 a.m. to 9 p.m. in both English and Spanish. And they can answer all your questions related to cancer. They can also help you find local support groups, smoking quit lines, and screening programs to help you take action. We cover a lot today, so let's do a quick recap. There are 5 easy steps that you can take to take control of your cancer risk. First, you want to talk to your family about your health history. You can download the CDC app to track your family history and get your family tree. And you can take that family tree and talk to your doctor about cancer risk prevention and screening options. You can also use the helpline to find local support, smoking quit lines, screening resources, and finally, by making a small lifestyle and environmental changes to decrease your cancer risk, like quitting smoking, protecting your skin, and airing out your home. Every step is a small step, but it can really make a big difference. So I thank you so much for your time and attention, and I hope you feel empowered to take control of your health today. And please don't forget to connect with us by scanning our Linktree QR code right here and to find more resources, cancer information, our social media pages, and our community events. And I thank you so much, and I'm very happy to answer your questions during the Q&A. Thank you.
Thank you so much, Dr. Escobar. I want to say I learned one important thing that I didn't know. I didn't know about my home having the capability of being polluted by all the things you listed, the candles, the air freshener and whatnot. So that was like a new one to me. I already thought, okay, what I need to open up my doors because I would say I'm pretty guilty of that. But thank you for that information. I'm going to move right along to our question and answer session. And if you don't mind, to our audience in the different rooms or join us online, please feel free to put in your questions in the chat. And when I'm done with the questions I have here, I will be more than happy to ask yours as well. So Dr. Escobar, the first question I have here is, are there genetic tests available that can help assess my cancer risk? What should I consider before getting tested?
Okay, sure. That's a great question. Yes, there are many genetic tests that are available to assess your inherited cancer risk. They are tests that analyze genes like the BRCA gene, the MLH gene, and the TP53 gene that are very common in hereditary cancers. And before testing, you should consider first, like your family history again. If you have multiple people in your family that have a certain cancer or they were diagnosed really early, like before age 50, that could be an indication that you need to have genetic testing. Also, you need to consider like the psychological impact, like knowing your genetic risk can be stressful, and using a genetic counselor is recommended to guide you through the process. Another thing that you should consider is medical actionability, because like knowing some of the genes and mutations, there's some that you can take preventive actions and get screening, and there's some that you can. There's no way to screen. So knowing which ones you can take steps to screen and do something about is very important.
That's awesome. Thank you. And I guess that's where the genetic counselor can help you review and you know what your next steps ought to be. Thank you, Dr. Escobar. The next question I have here is, if I test positive for a cancer gene mutation, what steps would I need to take next?
Sure. So if you test positive for a specific mutation, in general, the things that you can do is first talk to to the genetic counselor because you need increased surveillance, so more screening more frequently, like having annual mammograms and MRIs if you have like a BRCA mutation. Also consider the risk reducing surgery. So a couple years ago, Angelina Jolie wrote a piece for the New York Times because her mother died of ovarian cancer and she's a carrier of the BRCA gene. So she decided, because she was at increased risk, to have surgery to remove her breast tissue and her ovaries to decrease the risk of developing cancer. So that's something that you can do to have surgery to reduce your risk. There's also some medications that you can take to reduce the risk, like tamoxifen, that is used for breast cancer. And of course, doing lifestyle modifications like having a healthier diet, exercise, stopping, if you smoke, stop smoking, and have like a really good family communication and inform all your relatives that you tested positive and they also at increased risk. But using the genetic counselor is very important because they will really guide you through the whole process.
Thank you, and that makes sense. Now, talking about speaking to family members, the question I have though is, how would one go about initiating cancer risk conversations with family members who might be hesitant to share? Some people are pretty much private, and sometimes it could be cultural or don't speak about it out loud because maybe it might bring you bad luck or whatever. So, what would you tell a person who is wanting to know how to initiate such conversations?
Sure, that's such an important question. Yes. That is true. There's like a lot of cultural factors involved. Some people really just think of cancer and they think of death and they don't want to talk about it. But approaching the conversation with sensitivity and clarity can be very helpful. So there's always somebody in the family that usually likes to talk a lot and they know everything about the family. They're kind of the historian of the family. So it's starting with that person, it's very helpful because usually they're very willing to share. But you can also start by with your own health. You can say, I recently learned about genetic testing and I wanted to understand our family history and the illnesses that run in our family. And I would like you to, if you can share anything that you know about our family so that I can use that information to talk to my doctor. Also using like a not judgmental tone because some family members fear like stigma or being blamed for the cancers in their family or the diseases in their family. Also providing education and telling them, they are genetic counselors, we can get tested, there's ways to prevent it by doing early screening. So there are options available, and also respecting like the boundaries. As you said, there are people that just don't want to share, and that's okay. That's okay. There's people that do want to share and there's people that don't. But offering resources and information from like the CDC or the cancer National Cancer Institute, and also like a genetic counselor can be like really helpful to open up the conversation.
Thank you. Most times when we go into like, for our doctor's visits, and we're filling out those paperwork, they'll sometimes ask, oh, does your mom or your dad have this or that? Now, we're just also wondering, what about extended family and cousins? Do they matter in terms of cancer screening and?
Sure. So Usually hereditary cancer syndromes affect like multiple relatives across multiple generations. So if you have like an autosomal dominant inheritance, like a BRCA gene, for example, is passed through all the generations. So somebody in each generation is probably is going to be affected. They're also like clusters of the same cancer. So there could be like multiple cases of breast, ovarian, and colorectal cancer or prostate cancer in your family. If there are like clusters of people that have the same cancer, that can suggest that there's a hereditary link. And also young age of the diagnosis. So if you have a lot of relatives that have developed cancer before the age of 50, it also increases your suspicion that there might be a genetic risk in your family.
It's good to know. Thank you so much, Dr. Escobar. The next question we have here is, what are the latest guidelines for screening for hereditary cancers, for example, for breast cancer?
Yeah, so the screening can be individualized, with working with a genetic counselor and then your doctor. But, in general, if you have a breast cancer like a BRCA mutation, usually they suggest doing an MRI and a mammogram starting like at the age of 25 to 30 or 10 years before that last person was diagnosed. So if somebody in your family was diagnosed at 40, then you have to start screening at 30.
Okay.
Um, and there's other cancers like colorectal cancer. If you have a specific syndrome called like the Lynch syndrome, you have to start doing like a colonoscopy every 1 to 2 years, starting at the age of like 20 to 25. And there are other cancers like ovarian cancer that they also suggest doing like a transvaginal ultrasound and check for markers and maybe do prophylactic surgery by the age of 35 to 45. So it's very specific to the cancer that you have. So and you have to work with your genetic counselor and your doctor to kind of figure out what's the best time frame and what is the best test that you can do. But those are kind of like the general guidelines.
Okay, thank you so much. Now I'm going to switch gears just a tad bit and and ask a question regarding cancer prevention. In your field, with community engagement and cancer prevention, what are some common misconceptions you have come across from people about cancer prevention?
Sure. So there are a couple myths. There are some myths, like one of the big ones is that only smokers can get lung cancer, and that is not true. There are other things like exposure to radon gas, exposure to secondhand smoke, or if you live in a very polluted industrial area, that can also increase your risk for lung cancer. Another myth is that if no one in your family had cancer, I will not get cancer. Most of the cancers are not actually hereditary, they're sporadic, and they depend a lot on our lifestyle and our environmental exposure as well. So even if you don't have any family history of cancer in your family, you can still get cancer. Another big one is the use of antiperspirants and deodorants. A lot of people think that it can cause breast cancer, but there's really not a lot of evidence that support this. Some people were worried about the exposure to aluminum and other things in the deodorants like parabens, but there's not really strong evidence that it can cause cancer. So that one is also a common myth. And also, like living a healthy lifestyle, it reduces your risk of cancer, but it doesn't completely eliminate it. So even if you're very healthy, it can unfortunately happen to you that you can still be at risk of having cancer. It's less likely, but it's very possible.
Wow. I'm just like, so that means we can't get a break or something. Oh my goodness. Left, right. Okay, I'm eating healthy, but no. Or I'm walking 150 minutes, a week. No. Wow. All right. I guess it's just the grace of God. So I have a question with the resources that you so kindly shared with us just in your presentation. What is the best way to maximize the effective use of these resources?
Okay, that's a great question. So the CDC app is very helpful, like to gather your family information. And within the app, it takes like 5 to 10 minutes to put all the information in the app. And within the app, they have resources for you to learn more about your family history and to learn more about like screening options. So the app is very helpful. The NCI helpline, it's also extremely helpful. You can call or you can live chat and they will speak to you in English and Spanish. And the helpline can be used to clarify any of the screening guidelines, to find clinical trials, and to also find like resources, and even they can even give you information to refer you to a genetic counselor. And also using like reputable websites like the CDC and the National Cancer Institute to learn more about cancer in general, to learn more about screening and prevention. And also like use your doctor and your pharmacist because they're very knowledgeable about what you need, especially like the pharmacists know a lot about the vaccines. And there's two vaccines that I mentioned that prevent cancer, and getting those vaccines can also be very helpful in reducing your risk.
Thank you very much. I'm a pharmacist by training, and then yes, we usually do have that. When I used to work in the retail field, we had a lot of those, of people walk up to us and ask us those questions, and we were able to, based on the risk factors, their age, their comorbid conditions, be able to tell them, okay, this, you probably are a good candidate for this and whatnot. That's great.
Yeah.
Thank you so much. I had one more question, if you don't mind, and please feel free, everyone, to put questions in the chat if you want us to go ahead and take those live. But the last question I have here is, how often should one undergo cancer screenings? Is it just the one time, with a genetic counselor, based on family history and lifestyle factors, or does one need to repeat it? And if so, how often?
So, if you do genetic counselor, usually it's like a one time, you go with them, the doctor refers you and they tell you like you're at increased risk, based on the test. Usually they use a blood sample or a saliva sample to figure out like your risk, and they will tell you if you need additional testing, but it's usually like a one time or two-time thing. If you need additional testing, they will tell you. Um, but they're very good at guiding people and navigating people to get, the testing that they need. And usually, if it's covered by insurance, sometimes it's not. But if you really need it and you get a referral from your doctor, they will more likely than not cover that testing as well.
Thank you so much. Thank you so much. Now, regarding testings and screenings, I have a question here from someone in the audience here, and we can always address it later if the answer is not really available to us. But I want to ask this for somebody who is a high-risk individual, how can they advocate for themselves to receive better access to screenings and prevention care? Would the help hotline help them? Would the CDC side help them? What would with their best at least the first thing they should do in trying to advocate themselves, to receive access to screenings and preventative care?
That's a great question. Yes, so you are your best friend and you have to advocate for yourself. And the best thing you can do is talk to your doctor.
Mhm.
Tell your doctor, listen, I'm really concerned about my family history of cancer and certain diseases that run in my family. I want to know, what I can do to get tested, or if I need to do screening early. Like, you really have to have a great conversation and a relationship with your doctor, and really talk to them about what you're worried about. The helplines are very helpful as well to find resources, but the main person that you need to talk to is your doctor.
All right, thank you. And then someone who is interested in just in what the recent research studies are saying, or clinical trials for somebody who is high risk for a particular relative for breast cancer, and they want to know about the latest information about breast cancer studies and stuff. Sorry, this is off. This is somebody who's asking that question. Will the helpline also be an option for them, or even their doctor as well, or is there something else that they can also tap into?
Sure. I think the helpline is extremely helpful because you can talk to them or you can live chat if that's what you prefer. Also using your doctor as a resource, but also using institutions like TSU. You guys have a lot of resources for the community to
For
get breast
popping up.
cancer screening. And using, MD Anderson and Baylor College of Medicine. We have the biggest medical center in the whole universe here in Houston, and there are tons of institutions like TSU, like Baylor College of Medicine, other hospitals that have tons of resources, and you will be able to get screening if that's what you need. There's somebody that will help you get screening and get the answers that you need. But the helpline is extremely helpful, and your doctor always is like the go-to person. If you have really a lot of questions, they're the main person that you need to talk to as well.
Thank you so much, Dr. Escobar, and I will call that a wrap for the Q&A session. Thank you so much for giving us of your time again. This past hour has really been insightful. I have learned, even as a pharmacist, so I'm about to go open up my doors and my windows for the next 10, 15 minutes. But thank you so much for your time. Really, really appreciate it. Thank you so much. And then on next, Brittany, if you don't mind sharing your screen, please. So please, would love to hear feedback from you. Feedback is very essential. Next slide, please. This helps us to get better, to improve. We are one who keeps improving by, suggestions from you, our community members, from you, our doctors, our patients, and wherever. To our CHWs, if you want CE credit, please fill out this, click on the, scan the QR code, or you can click on the link in your Q&A session, and we can and go ahead and fill out those forms, or our JOT forms, and definitely we'll send out your certificates to you. Please also fill out our survey. That helps us a lot. Thank you for joining tonight's webinar. Please expect to hear from us via MailChimp and via our social media platforms about next month's webinar. It promises to be exciting. It promises to be life-changing. It promises to be knowledgeable for you. Thank you. Next slide, Brittany. Thank you. And then also we had mentioned during last month's seminar that we are accepting applications for our next cohort, beginning hopefully by God's grace in June. So those applications have been closed, and right now we are reviewing applicants, and we'll share more information as they come forward. Thank you. And on to a great one, clinical research and engagement conference. We had one or two questions about clinical research. So please stay tuned for April 12th, 2025. That is actually 1 week before Easter. Feel free to join us in person on campus on TSU grounds, 3100 Claiborne Street here in Houston, Texas, or online just by scanning the QR code there. You can pre-register if you want to, but please join us for 6 hours of learning all about clinical research. There's also going to be a conversation beyond Tuskegee, wanting to hear what the community has to say about clinical research. So please make it a date. There will be light breakfast. There's going to be some lunch provided. And also it's not here, but there's going to be $15 gift cards given to 100 in-person attendees who, of course, fill out the survey and do some other little things. But the $15 will be for you to go enjoy lunch or something on us later on. Thank you so much for here. Thank you for being here with us, for giving us your time. Thank you so much. Until next month. Thank you, Dr. Escobar. Thank you, Brittany. Thank you to our AV Tech team. And we're signing off now. And hope to see you again next month. Thank you so much.